Hi, I'm Vicky. You'll be glad to know this is your last responding to symptoms lecture with me, and today we're going through skin part 2. After the lecture, you should be more familiar with common bacterial, fungal and viral skin infections that you'll see in the community pharmacy, how they present and how to treat them. By the end of the lecture, you should be able to differentiate between the different skin conditions based on their symptoms and the patient's history, be able to structure your questions to help you diagnose those conditions and seek out those referral symptoms and know when to refer. Also, be able to recommend appropriate over-the-counter medication and give non-pharmacological advice. So today we're going to focus on face and feet. Remember, you need to think about differential diagnosis. What else could be the problem? Remember those red flag symptoms, and in particular from the first lecture, and in particular the serious ones of meningitis, melanoma and cellulitis. Acne is a chronic skin condition caused by blockage or inflammation of the hair follicles and the sebaceous glands. It mostly affects the face, back and chest, and usually first occurs around puberty and is due to excess testosterone. It can be worse just before or during menstruation. So during puberty, testosterone production increases, and in boys it's to develop the sex organs, and in girls to build up bones and muscle strength. The increase in testosterone increases oily skin, and the excess sebum causes overgrowth of bacteria and sets off an inflammatory reaction, forming spots. There are generally three types of spots. So you have blackheads, which are open. The follicles here have a wider opening than normal, so they get plugged with sebum and typically have a black appearance. Whiteheads are closed, and they're filled with the same material as blackheads, but they have a smaller opening on the surface and appear white. And then finally there are inflammatory lesions. So these are papules, pustules and nodules. They are more severe lesions. Papules are small red bumps that might feel tender or sore and are generally less than 5 millimeters. Pustules are similar to papules, but they have a white tip in the centre, and this is due to a build-up of pus, and they are less than 5 millimeters. Nodules are large lumps, quite hard, and they build up beneath the surface of the skin and can be quite painful. They can go on to cause scarring, and generally they're larger than 5 millimeters. Cysts are the most severe type. So they're similar to nodules, but they get filled up with pus. Here are some images which show typically what each type of spot looks like. The most severe are the nodules and cysts, and that they are more likely to cause scarring. There are three main types of acne scars. That's ice pick. They look sort of like tiny holes. Rolling ice scars have quite an uneven appearance, and boxcar scars look a bit like craters. There's another form as well, keloid, which are more pronounced on the skin. And the next slide just gives you some images of those. When do we need to refer? If there's any weeping, bleeding, signs of infection, if the skin is cracked or broken, if there's any pain with the acne, if they've tried treatment and it's failed, and any nodules or presence of any nodules or cysts, because this is quite severe acne and it's going to need more potent treatment than what we can offer over the counter. We must let people know that you need to persevere with treatment. It's going to take several months to show any benefit. This isn't going to be a quick fix. Over the counter, there are topical treatments available. There are a lot more preparations available on prescription. For example, we can use topical antibiotics, we can use oral antibiotics, and also the combined oral contraceptive. So there can be a lot of judging for young teenage girls who are taking the contraceptive pill, but actually they might be taking it for acne rather than their contraceptive use. Benzoyl peroxide is the treatment available over the counter. It prevents dead skin from plugging up hair follicles and kills bacteria on the skin, but it prevents new lesions rather than reducing existing ones, so it's important to stress that to the patient. They need to wash the skin and fully dry before applying the product, because this would reduce the amount of sebum on the skin. That's best done with lukewarm water rather than hot water, because hot water can cause stinging. You need to leave the product on the skin for about 15 to 20 minutes before washing off, and this is because it can cause burning, itching, stinging and irritation. So you can start off leaving the product on the skin for about 15 to 20 minutes, and you can gradually increase that contact of the product on the skin over time. The product's also available in different strengths, so again, to reduce that irritation, start off on a low strength and you can gradually build up over time. It does cause the skin to be more sensitive, and therefore UV protection advice is also required. There's lots of different licensing differencing between the products, so always double check before before you sell it to the patient. Those practical tips we can give: washing the affected areas of the skin to help keep them clean, using a mild soap or cleanser, lukewarm water rather than hot or cold, because that can make it worse. Try not to clean out or squeeze the spots, and try to avoid too much makeup and cosmetics, because that can block the hair follicles. Using water-based products are better for acne. Completely remove any makeup before going to bed. If dry skin is a problem, then you can use a fragrance-free moisturiser or a water-based emollient to help with that. Regular exercise as well, although it doesn't improve the acne, it does boost your mood and your self-esteem. Often acne, because it's so visible to others, can really affect your self-esteem. Shower regularly, and washing hair regularly helps, because the grease in the hair can exacerbate the acne on the skin. Common acne myths. Acne is not infectious, so you cannot pass it on to somebody. It's not caused by a poor diet. Having said that, it's good to encourage a good diet, as it helps with health generally. Acne is not caused by having dirty skin or poor hygiene, and this is because most reactions causing acne occur beneath the skin rather than on the surface. There's no evidence to show that sexual activity can influence activity, and it's not good to squeeze blackheads or whiteheads. It actually makes the spots worse and can leave scarring. Sunbathing, sunbeds and sun lamps, again, there is no evidence to show that this improves acne. We're now going to move on to rosacea, which is a condition that affects older people, so generally between the age of 30 and 50. It's more common in those with fair skin, and you generally have flare-up periods where it's quite bad, and then you have periods of time where the symptoms calm down. So it's a relapsing condition. Some common triggers, so it's best to go through these with the patient and advise that they try and avoid these. There are some medications that can cause rosacea, so it's always good to check with the patient what medication they're taking and what medical conditions that they have. The common signs and symptoms, so it normally begins with flushing. You can get persistent facial redness, and the blood vessels can become visible on the skin with papules and pustules. It can lead to very dry or rough skin and facial swelling. You can see some typical images of rosacea here. So you can, on the top left picture, that's a typical sort of red cheeks that appear, and then the picture below that you can see the pronounced redness with thickened skin, and then the picture at the top there you can see development of papules. There is no treatment available over the counter, so all patients need to be referred, but you can give the patient some practical advice in the meantime. Preparations are available for treatment on prescription are topical preparations such as metronidazole and oral antibiotics. Practical advice, a lot of it is based around avoiding those triggers. So sunlight, stay out of the sun when it's at its hottest. Use UVA and UVB protection, factor 30 at a minimum. Stress, try and avoid stress or be able to deal with stress as much as you can. So maybe do some regular exercise or learn some relaxation techniques. With food, trying to stop having spicy foods, alcohol, and maybe keep a food diary to see if you can tell what foods are triggering off the symptoms. In the cold weather, try and protect the face as much as possible, so using a scarf or a balaclava. And there are some skincare techniques that can be used. Those skincare techniques, cleanse the skin in the morning and evening with a gentle cleanser. Always use lukewarm water, and that's standard advice with all skincare conditions. Make sure the skin allows the skin dries fully before applying any makeup or medication, and try and use those products that are formulated for sensitive skin, and using using water-based products instead of oil-based. We are back in your busy community pharmacy, and you have a lady that comes in with her 16-year-old daughter asking to buy something for acne. So after asking your WHAM questions, you can see she's got some papules and blackheads. The skin is red, but it's not broken. She hasn't tried anything yet. She isn't on any other medication, and she has no medical conditions. So have a think what you want to do for the young girl, and then we'll go through it on the next screencast.